Thank you. So today, our pre-esteemed guest for the English session is Dr. Beatrix Gessner. She is a medical doctor since 35 years. And before starting today's session, let me introduce her.
Her screen sharing is not withdrawn.
Okay, just a second. Sorry, just a second. Dr. S.K. Mohiuddin, please remove your screen. Okay. Dr. Beatrix, you can upload your screen.
Yes, I tried. Can you hear me?
Sir, screen sharing is not withdrawn. Dr. Mohiuddin's screen sharing is still there.
The screen share is not audible. The screen share.
Okay, now it is better.
Yeah, thank you. So before you can upload your screen and I'll give a short intro about you. So Dr. Beatrix Gessner is from Germany. She's a medical doctor since 35 years and is specialized in dermatology, pediatrics, and general medicine. She's practicing homeopathy since 31 years, worked in the only hospital in Germany specialized on homeopathic treatment of severe conditions with allergies, asthma, and neurodermatitis since 1991. She's working in her own private clinic since 27 years, teaching regularly in the courses of our central homeopathic organization in Germany, giving seminars in Portugal since 8 years. Today, she has joined us with the topic Kali solves a broad spectrum in homeopathic treatment. Ma'am, please begin the session.
So, hello, thank you very much for the invitation. Until now, I don't know you, Dr. Manish. Happy to see you.
Thank you, ma'am.
And yes. So, I will share my screen. And first of all, I would like to introduce my topic because in my clinic, the KALIUM salts are very, very important. They cover a lot of symptoms and a lot of different pathologies. And they have a great healing power. For this, I was preparing that session for you. And now I will share my screen. Are you, Dr. Manish, do you see the slides?
Ma'am, yes, ma'am.
Yes?
Yes.
Everything okay? I can go on, yes?
Yeah, the screen is visible. You can go on.
Okay, thank you. No, it's not moving now. I have to stop again.
Yeah, ma'am, you have to try again, I think.
Yeah, I try again. So, I try again. So you see the slides?
Yes, ma'am, the slide is visible.
Yes, but it's strange, it's not moving. So what shall I do? Sorry, we will find a solution. Because normally it's moving without any problem. So try again. Okay. Go to you. Try again the screen. Okay. Okay. So, no, I'm okay. Thank you. Sorry for the delay. And let us start to talk about Kalium carbonicum. Kalium and the kalium salts have a great importance in plants, animals, and also in the human organism. And next slide, I have to do it like this. Okay. Prominent are the osmotic abilities of the exchange of fluids on the cellular level and also the transmission of the neuronal impulses within the muscular system. So we see already in the substance of kalium, we have the electrolytes, which means the water condition of the body, which means also a connection with the kidneys. We also have the muscular system and the connection between muscular system and neuronal impulses. And that we will also see in the homeopathic remedies we are using. If we have a lack of kalium, we feel weakness, muscular debility, quick heartbeat, a high kalium level of the blood indicates kidney problems. As a homeopathic remedy, Kalium carbonicum, we have special keynotes. If we see the structures, we see the swelling and the edema. The swelling is mainly around the eyes or around the joints. We have weakness and we also have perspiration. That's very typical for Kalium carbonicum. Yes? Do you hear well, Dr. Manish?
Yes,
You're
ma'am.
listening well? Yes?
Yes, ma'am.
Everything all right with you? Because you are looking at a bit serious.
It's a old
So,
habit, ma'am.
everything's fine.
Can't do anything.
Okay, okay. So very important also the time of aggravation between 2 and 3 o'clock. That's very typical for different symptoms. If the person has cough or asthma or cannot sleep or have stomach pains, so aggravation at 2 and 3 a.m. is very, very typical and can lead us to find the remedy. Kalium salts are very sensitive to touch and they have a kind of slow velocity with continuation. That's also very important. So kalium remedies are not so easily detected. They have changing and contradictory symptoms. Diseases seem hidden, but progress slowly and continuously. That was Dr. Kent already observing. It's not easy always to detect in the kalium aspects in our patients. And kalium salts are very valuable for autoimmune diseases. So the psychological picture is also very interesting. We have control and perfectionism. These people are very structured. They like to have order with everything. They like to have the law correct. And so often they are policemen as a profession or they are lawyers. So this is very important for them. And this also means a certain want of flexibility. At the same time, they are very sensitive. Outside very rational, inside very sensitive. And they show a certain ambivalence. They have a lot of fears, fear to be alone, fear about the future, fear about death, and strong fear of diseases, to lose control. They're crying, telling about their sickness. And as symptoms, we have a lot of sinusitis with swelling around the eyes. We have swollen tonsils. We have discharge of the ears, all kind of acute conditions in infections. So in my clinic, for sinusitis, it's Kalium carbonicum is number one to treat my patients. If they have that pain around here, if they everything is swollen around the eyes, the nose is stuffed, and I use Kalium carbonicum C200 twice a day, morning and evening. And often I also give Kalium bichromicum in low potency during the day to help the discharge becoming more fluid. Also great remedy with bronchitis, asthma, especially if it's worse at 2 a.m. or 3 a.m. Many complaints with the stomach, gastritis, acid stomach, ulcer. And very special is the stomach has a heavy feeling and they feel also anxiety or fear in the stomach. A great range in symptoms of a woman, female problems. They can have strong bleedings. Very typical is a tendency of abortion. And the deliveries can be difficult because as a person, they are not so flexible to go on with the waves of the happenings. And also after birth, during lactation, it can have difficulties, loss of hair, difficult lactation, a bit similar with acidum phosphoticum, as we know, is also very typical for that situation. Then we have back pains, very typical also, back pains which are extending to the legs. They like pressure, they like a hard bed, and very typical is if when they are moving, turning in the bed, the pain is getting worse. Also very connected with the thyroid gland, important remedy, especially if it's connected with weakness and sweating, muscular weakness and heart problems. All these symptoms we can have during problems with the thyroid. So a very good remedy for kidney problems, especially with stitching pain in the renal region, kidney stones, inflammation of the kidneys, and we see that also with the swelling of the eyes. As persons, often they are very sensitive to touch, especially at the soles of the feet. They have difficulty, like if they go at the beach and there are a lot of stones, they have difficulties to walk. They are very sensitive there. And they're also sensitive to cold, Kalium carbonicum. If you have Kalium carbonicum symptoms and it's a warm person, we have to think about Kalium sulfuricum. Yes? Okay. Also special is if they talk with the doctor about the problems, the symptoms, often they're crying, especially the woman. And they also have a typical kind of humor. They like to jest. The men are more like this, jesting, like to tell anecdotes, making jokes. And also observation of my teachers, and I also did observe, very often they have big ears. In a certain way, you can compare them a bit with an elephant. They are strong, but very sensitive, and they have these big ears. So, okay, let's start with the cases. I will present 6 cases now. So that means I will not go very much into detail with every case. For me, important now is to show you the variety of possibilities to treat with Kalium salts. So our first case is a woman. I know her very well since many years, and she developed a Hashimoto thyroiditis. So what is Hashimoto disease? Hashimoto disease, also called chronic lymphocytic thyroiditis or autoimmune thyroiditis, is an autoimmune disease. As an autoimmune disease, it is a disorder in which the body's immune system attacks the body's own cells and organs. And I don't know how it is in India. Here in Germany, it's sadly enough, it's a very common disease at the moment. Many, especially women with Hashimoto, and the normal way of developing this disease is they have in the beginning the hyperthyroidism. So they have palpitations, they have perspiration, loss of weight, fatigue, the too much. And in that phase of the disease, it's like the thyroid is being eaten by the autoantibodies of the body until it's finished and goes into hypothyroidism. And normally our normal medicine, conservative medicine, allopathic medicine does not have cure for our Hashimoto. So if the second phase would be the second hypothyroidism with fatigue, gain of weight, freezing, cold intolerance, loss of motivation, and loss of concentration. So this patient, 55 years old, it's more or less 10 years ago. So I have a long-term observation of this lady, and I know her very well. And she was being treated with different remedies because she had chronic headaches and stomach problems. And one day, all of a sudden, she came into my office and she said, I'm feeling totally different, very weak, lot of heart palpitation. And I lost a lot of weight in the last 2 weeks. And my concentration is terrible. So I said to her, better to control the thyroid. And it was confirmed, very high antibodies, and she was advised to take thiamidol. And like I am a family doctor for all my patients, I'm working as a family doctor, and I know my patients many, many years. They always like to go on with homeopathy. They don't want to go to allopathy. And she begged me, please, doctor, can you treat me? And I said, I try my best, but we will see how the outcome will be. So I just did take the symptoms. She was feeling very weak, perspiration and flushes of feet. I gave Kalium carbonicum C200 a single dose. Why Kalium carbonicum? We had that perspiration, that weakness, and Kalium carbonicum is known to be a very good remedy for the thyroid. So after 210 days later, she's feeling better already. She has more energy, less perspiration, and the heart is more calm. So it seems the remedy is working well. 2 weeks later, since a few days, she has more palpitations again. So we did repeat the Kalium carbonicum 200. 4 weeks later, step by step, she has more energy, is gaining weight, has less perspiration, but still feels not 100%. So I decided to repeat again, Kalium carbonicum 200. I could have given 1000 also, but as she's going on a good way, I said, okay, again 200. And 6 weeks later, everything is fine. The autoimmune antibodies are down, and the Hashimoto thyroiditis is cured. And now 10 years later, she's still fine. She has little other problems, now more or less 70 years old, but everything is fine with the thyroid. So we have been very happy. And conclusion, the quick and extraordinary response might be due to the good vital force of the patient and the well-chosen homeopathic remedy, of course. But this is also an example to show you that the Kalium salts are very strong. They have a great healing power, and they're very strong in autoimmune diseases. So let's see the case number 2. That's a lady with arthralgias, edema, eczema in menopause. That's a lady, also patient since many, many years in my office. 53 years old woman. She's a nurse. She's working a lot. And she has an eczema on her right hand, and she has been treated in my office for many years because that was very difficult for her as a nurse to work in the hospital with the eczema at the hands. So, and she also developed arthralgia, pain of the joints, and menopause problems. So she's crying a lot, especially if she's talking with the doctor about her problems. She's very sensitive. And she has also reason to cry because she has two sons and both of them have difficulties to write and to read. So before her first child, she had a miscarriage in the 12th week, and afterwards 2 miscarriages in the 6th and the 7th week. So she has a tendency of miscarriage also. She's coming for the consultation because she has an eczema at her right palm, yes. In the face, I see, it's always very important to observe our patients. I see swellings under her eyes. I detect that into the laboratory. At the moment, she is very forgetful and is complaining about a lack of concentration and motivation. Menopause is beginning. So with menopause, a lot of changes in the hormonal systems, and she's perspiring at night, but her general temperature is cold and the sleep is not so easy. That's also a symptom of menopause very often with a woman, and she's waking 3 or 4 o'clock and cannot fall asleep again. So she has not enough energy during the day, but she has to work. It's not so easy. Also, she put on much weight and she has more back pains because of that in the lumbar region. And also she has pain in the knees, it's difficult to walk, she's not feeling well, she's a bit down with everything. Okay, summary. What do we understand with this case? We have a hormonal remedy, tendency of miscarriages, beginning menopause, person who's very sensitive, waking at 3 or 4 o'clock, stiffness in the joints, arthralgias in the left knee, swelling under the eyes, perspiring at night, lack of concentration, too much weight, edema. So the remedy picture could not be clearer. It's impressive how we see the materia medica in our patients. And homeopathy is a practical healing method based on observation. That's very, very important. We have to look at our patients. So here we see the repertorization, crying, causeless, involuntary, swellings, a lot of swellings under the eyes, around the eyes, swelling of hands, swelling of feet, waking at 3 a.m., waking at 4 a.m., miscarriages. So we see kalium, carbonium as a first remedy, also followed by sepia, phosphorus pulsatilla. So I did choose kalium carbonicum for her, a single dose of C200. And let's see what's happening. Next 3 weeks later, we are talking, and she's telling, one day after taking kalium carbonicum, she got her menses again. Sometimes these things are happening. That's a strong sign that the remedy is well chosen. And because of the menses, she's feeling better. She has less swellings, she could sleep better, and she was feeling very well. So, but now she's perspiring a lot, she feels pain in her right shoulder, and she has pain in the coccygeum, which is an old symptom. And the eczema at the end is a bit better. So what shall we do? Some symptoms are better, some symptoms are rising, which are old symptoms. So I decided to wait. 3 weeks after 200, we can wait. As we know, Ken says with a potency of C200, we should wait 4 or 6 weeks if it's a chronic case. Okay, 3 months later, everything is fine. 2 months later, 5 months after the beginning of the treatment, she feels more light and not so tired. The flushes of heat are better. Her knee is much better, and the skin is also very good. But now the symptoms are getting worse again. So I did repeat kalium carbonicum C200, follow up in the following years. She's a chronic patient in my office. In the following years, as a summary, she needed kalium carbonicum C200 from time to time, always with a very good result concerning the swellings, the menopause problems, and her joint pains. Conclusion: the remedy is working very deeply, and she needs only rarely single doses of kalium carbonicum. Never needed investigation at her knee, arthroscopia. Never needed that, and is doing well. Okay, let's see the next case. Also an autoimmune disease, very sadly, with a young lady. Lupus erythematodes. That young lady, she's 31 years old, a teacher of sports and German. She has a diagnosis of systemic lupus erythematodes with arthralgia and kidney affection with hypertension, which is very dangerous. She had to go to the intensive ward, has been treated with a lot of cortisone, a lot of strong remedies, medication. And let's go to the history. 2 years ago, she developed fever attacks and joint pains. It started when she was working as a teacher in her practical year. She had a lot of stress because she is very perfectionist and has a strong anxiety of failure. That's also typical for kalium salts. Originally, she'd like to study medicine, but her parents said, don't do that, it's too difficult. Become a teacher like us. So she was not feeling 100% well. She developed sleeping problems, waking at 3 o'clock in the morning, thinking about the problem because she had that ambivalence, being a teacher and she wanted to become a medical doctor. So if we see the rubric, there's a rubric, it's called antagonism with himself. We have some remedies, anacardium, very well known, ignatia, very well known, sepia also, but we also see kalium carbonicum in that small rubric. She has pains in different joints, especially in the knees, and this is a big problem because she's a teacher of sports. She also has pain in her right wrist and cannot write at the moment. And in last summer, she had a severe crisis with her kidney and had to go to hospital to intensive care. So if we look at the family history, the father has rosacea, which is also autoimmune disease of the skin in the face. The uncle has morbus Bechterew, also autoimmune disease. Grandmother, cancer of the liver, and grandfather, morbus Parkinson. So situation also not so easy. If we take the symptoms, we take lupus erythematodes, the swelling of the feet, of the leg. She did like chocolate a lot, waking at 3 o'clock, antagonism with herself. Kalium carbonicum is coming as a first remedy. I was a bit surprised with the repertorization. I said, kalium carbonicum. Oh, that's interesting. So with her, I started with LM potencies because she has to take strong medication. She has to take cortisone, methotrexate, MTX, and antihypertensive drugs because of the kidney problems. So I gave kalium carbonicum, LM1, twice a day, 5 drops. Only 6 days later, she's calling me. She says the sleep is better. If she wakes up and goes to the toilet, she can sleep again. She does not think so much about her problems anymore, and she feels more confident. And the joints, the stiffness is also better. She can reduce the cortisone. And also urination feels better. So on all levels, she is feeling better only after 1 week with an impotence of kalium carbonicum. So I said, okay, we go on twice a day. 1 week later, he feels good energy, the joints feel more soft, the blood pressure went down, and she can reduce her antihypertensive. So that's only 2 weeks after beginning with the remedy. So I say, go on twice a day. 1 week later, 3 weeks after treatment, after half a year now, for the first time, he started to work at school. slowly with a few hours, and she could enjoy doing it. The ambivalence of working in school is less. And she can move with more flexibility. Also, her physiotherapist was noticing that. So she's much better. Long-term follow-up. She has experienced now 1 year of school. During these years, she was improving, was able to work. She can make her decisions more quickly. Because before she was telling me, as a teacher, she has to give notes for the students. And she was thinking so much if she should give the note 1.2 or 1.3. She was so meticulous in everything. And now she's doing it more with more flexibility. And to the astonishment of her specialists, the kidney kept silent and safe. So we are very happy about that. Conclusion. Kalium salts are very strong in the treatment of autoimmune diseases, also with combination of kidney problems. The amelioration of the whole system was very quick in spite of the strong allopathic medication. In spite, that's very, also for me, was very impressive. And LM potencies, the other colleagues, Dr. Manish, say, no, I love LM potencies. I use them a lot in my office. So LM potencies can work wonderfully in combination with allopathic drugs, and that's a very good tool to have. So let's see the next case, which is a bit complicated. A woman with muscular weakness and epileptic-like attacks. Here we see the woman, also a patient since many years in my office. When she was born with an astigmatismus of her eyes. And when she was a small child, they made certain therapy, putting one patch here. She could only see with one eye and later with the other. But for her brain, that doesn't seem to have been very well. So now she's a woman also working a lot with computers, and she is working in a interesting sphere. She's controlling the business of the local government. She's controlling the money, and has to work with the computers, of course. And if there's something, if too much stress, she will get like an epileptic attack. She has to lie down, she cannot move, and for half an hour more or less, the colleagues, they know, the family knows also. And normally next day she's feeling very weak with her muscles. And normally since years I was treating her with causticum, which was helping quickly. Normally she's phoning me, doctor, again a fall. I said, okay, now you take the causticum C30, and she was going well. She was happy. Okay. And she always said, within no time, she said, it's like a miracle. I take the globules and I'm better. And this was working since years like this. She had more or less 3-4 attacks per year. It was not very severe. So, but now she's phoning me. 5 days ago, she had her last attack, and she was taking the causticum. Concentration became better. This time, the muscular weakness not. And she's feeling very weak, and she does not know why. So sometimes that happens in the course of long-term patients. We have a good homeopathic routine with them, everything is going well, and from one moment to the other, the remedy is not working anymore. So we are in a difficult situation, and in that case, now we have to look for another remedy. No use to give more causticum. And that's the point I also want to point out. And causticum is interesting, is also a kind of kalium salt. It's the only remedy which was created itself by Dr. Hahnemann, and it contains calcium, kalium, and sulfur. So I decided to choose a new remedy because of the muscular weakness. But the remedy I have to choose, and that's very important information also for you. If we work long-term with our patients, I would not choose a remedy which is very far away from kalium carbonicum. from causticum. It has to have a connection with causticum because causticum was helping a lot since years. So I decided in that case to give kalium phosphoricum because kalium is also a substance in causticum, and kalium phosphoricum is because it's well known as a remedy for muscular weakness. And 4 days later, the weakness was clearly better. Okay, follow up after years. This patient now is suffering from many problems. Flushes of feet, hypertension, sleeping problems, changing moods. Okay. Concerning her temperature, she's more warm now. So I decided to switch from kalium phosphoricum, which was helping once, to kalium sulfuricum, which is a very good remedy for the woman in menopause. I have very good results in that remedy. And to show, in German we say, the apple does not fall far away from the apple tree. So if we have a good working remedy and something is happening, not working so well again, look in the near region of the families of the remedies. Okay, I have a little boy with recurrent bronchitis, case number 5. I know him since 4 months old. He has problems with eczema, with chronic bronchitis, and he was a newborn, which came too early, 8 weeks too early, 2 months too early. So he was very small, and these babies have problems with the lungs afterwards. You know? And before his pregnancy, his mother had 3 miscarriages. Perhaps she also is a kalium type. I will see. So now this boy is 5 years old. He was very well responding okay. Now he has chronic recurrent pulmonary infection at the moment. Strong cough, bronchitis. The mother cannot bear anymore to hear that cough. He's waking 2 o'clock at night, perspiring at night. He's quite obstinate. And all these 5 years, he was treating well with sulfur for his pollinosis and allergies, and also with some doses of tuberculinum. But these remedies at the moment for this bronchitis are not working anymore. So I said to myself, Dr. Beatrix, sulfur was very good and tuberculinum. So the remedy has to be close to sulfur. And waking at 2 a.m. at night, I decided to give kalium sulfuricum. You understand the idea? Switching from sulfur to kalium sulfuricum. 3 times a day, it's a strong doses because he was coughing so much. 2 weeks later, the cough is much better, so we can reduce the drops to once daily. And in the following 10 years, he's now 15 years old. He was responding very well if he had a cough or allergy with kalium sulfuricum LM potencies. And from time to time, he needed some tuberculinum as a chronic miasma. So conclusion, it seems that the kalium salts have a tendency of long-lasting effects that goes with the patient for many years, being helpful for years. This is my observation after my clinic of 30 years. So we have time for another case, which is a big case now. I presented this case in the NIGA Congress in October in Bogota, Colombia. And this case will be interesting for the remedy, which was difficult to find. And also for the potencies which were chosen, because in the middle of the case, we had a lot of trouble. And also for the slow velocity of cure, which has resonance with the remedy. So this is a lady. Now she's looking happy, but in the meantime, before it was a different situation. So case history. She has ulcus curious with inflammation around, it's called phlegmona. She has problems with the thyroid, a hypothyroidism. She is a fat woman, adipositas and hypertonus. I know this lady since more or less 20 years. I know all the family, the children, the parents, treating all the family. Okay, and she has been responding very well on Calcarea carbonica for her obesity, her joint problems, headaches, many, many years. And then with menopause problems, she shifted to Kalium carbonicum state and was stable all the years. But after an insect bite, she developed an ulcus crus here at the leg. I mean, the legs are quite swollen. She's a fat woman, not so much healing so well, but with that ulcus, I prescribed Lidum and Vipera, and as a result, the ulcus stays without pain. This lady is living more or less 1 hour from my consultation room, so we phone a lot. She cannot come every few days, and so 3 months later, she was not calling me, nothing. She said, "Oh, doctor, it's getting worse now. I still have the problem, but now I get an inflammation around." Okay, I was giving Lachesis 1 dose, 200, and because it was acute inflammation. And 1 week later, it was less bluish, but now becoming red and more itchy. So I said, "No, you have to come." And she's showing the leg. And if we see that leg with redness, itchy, we see sulfur. I said, "Okay, we start with sulfur, C30 once a day." And I had in my mind that could be a beginning erysipelas, a beginning inflammation, which is quite dangerous. At the moment, she does not have any fever. Okay. 1 week later, the situation seems stable, no fever. Okay. 5 days later, getting more red, more itching. She's coming and showing the leg. Not so good. So, not so good. So I said, you have to be careful. Take now sulfur 200 once a day and give me a phone call. Now we treat as an acute condition to prevent an erysipelas. But now she was taking every day, not phoning me. 1 week later, she's worse. Now she is itching at the arms, the legs. Here you see the arms with redness. The leg is worse again. So I said to myself, we cannot go on like this. And I shifted because she had been treated very well with calcium carbonicum before in her history, and sulfur was not working so greatly. I shifted to calcium sulfuricum, which is as we know, a very good remedy for the skin. I was giving C30 twice a day. Okay, 1 week later. Okay, the arms are better, the ulcus seems smaller, legs seem less swollen, more or less, not very happy, but more or less with the patient. So I say, okay, we go on C30 once a day, not twice a day because it's getting a bit better, once a day. Okay. But now she's phoning me, oh, it's getting worse again. So I said, no, we stop the remedy, don't take too much this time. And we wait. 3 days later, she said, oh, it's terrible, doctor. I had to work a lot at the office, and at home, I had a lot of guests. I had to cook. I had to stand in the kitchen, and now my leg is so bad, and it really was very bad. So, more itching, painful swelling, luckily no fever. And I said, I'm sorry now, you have to go to the hospital. I cannot treat that here. You are living in another place. But she said, no, I don't want to go to the hospital. Please, doctor, you have to do it. These KALIUM patients, they can be quite obstinate. So I said, okay, I will give a last try now. And we are now 2 weeks after the beginning of the acute condition. We are in a difficult situation. The case is not going really well. Something has to happen. I was not so happy with Calcarea sulfurica. So we have to look for a remedy which is very close to sulfur and Calcarea sulfurica. So I decided also here to switch KALIUM sulfuricum. KALIUM sulfuricum. Okay. because the kalium sulfuricum was helping her very well for the menopause. Now she's more warm-blooded. The remedy is close to sulfur, kalium sulfuricum. I said to her, now you go home, you lie into bed, you may cool your leg, you don't walk around. If it's not getting better in 2 days, you have to go to the hospital. I have to be very strict with you now, please. And take kalium sulfuricum today and tomorrow and no more any afterwards. Not taking too much. Okay, like this. And 4 days later, telephone call. Now she says, interesting. She says, doctor, now I feel a difference. I said, what is the difference? The leg is more calm. It seems a bit less swollen. I feel better. My arms and the skin is good. And the ulcus has closed. Only after 4 days. It's impressive. So, situation is getting better. I did not repeat. I said, please come and show your leg. So, here's the leg. It's still not very good, but we see the redness is a bit slightly better, and the swelling is slightly better, and we see that kind of scabs. Okay, so after 1 week with 2 doses of kalium sulfuricum in the beginning, we know we are on the right path now, but now we have the next problem. How will we manage the potencies? What shall we do? And we will not like to have too much up and downs in this case now. So as I'm very used to work with LM potencies, I started to give her LM potency, kalium sulfuricum, twice a day, 10 drops, which is quite a high dosage. So 1 week later, she's feeling better, less pressure in her leg. She can walk a bit better. The leg, the ulcus is closed, the leg is getting better, still not being very well, but if an allopathic doctor would see that leg now, would send her also to the hospital, I'm sure. But we know we are on the right path. Okay. I say go on twice a day. 1 week later, everything is getting better. Sometimes she has a stitching pain, and now she can walk better. Now, the next difficult situation. I know she will not lie in bed anymore. 2 weeks she was lying more or less. She's walking more. So the pressure of she will have more pressure on her leg, and she has stitching pain and still a red leg. So I decided to add APIS. Here's the leg. I decided to go on with the kalium sulfuricum and add APIS once a day, 200. 10 days later, getting better, less inflammation, less swelling. Now we see it's getting better. And I continue. Here you see, so the water is going out, the edema is going out. You see the little dells in the lower leg. So we are 4 weeks now after the beginning of kalium sulfuricum LM. This is not an acute condition, it's a chronic infiltration of the leg. So we go on with twice a day, kalium sulfuricum. Now we have LM3 and APIS 200 once a day. Here's the leg. Here she's getting better, better. 2 weeks later. 2 weeks later. Always going with the same medication, twice a day and APIS. So now everything is so much better. I reduce kalium sulfuricum 10 drops to once a day from twice a day, but we go on with APIS. 4 weeks later, so you see long time, but getting better. Now we are in a happy situation. Everything is cured, has healed. A photo can tell more than many words. So everything is clear and clean, and she's happy. So conclusion, the right constitutional remedy made the change in a few days. Calcium sulfuricum and kalium sulfuricum are close. It is very helpful to know the minerals and their salts. So kalium salts have that slow and profound acting energy. And LM potencies brought more continuity. So thank you very much for your attention.
Thank you very much, ma'am. That was a very fruitful session, and it was really great to learn. And we got a lot of things to learn and carry on from this session. So we have 9 more minutes left. So there are many participants which have joined us live right now. If there is any question you want to ask, so please go ahead and ask. Or any review about the session, so please go. If you want to say anything about the session, please go ahead and please continue. Yeah, there is a raised hand from Ma'am Marian. Okay, please go ahead.
Thank you very much. Good morning, good evening, good night to all of you. Thanks, Beatriz. Really nice session. Impressive the way that you treat your patients and you have results with homeopathy. So I have a little question. First, I want to congratulate you because you always are sharing all your knowledge and experience with all of us, especially in America. So thank you very much, and thanks to Ifph team. And the question is, how you arrived to conclusion to start with Kali and not with Calc?
With Kali and not with?
Calcarea phosphorica. The last patient you thought about Calcarea phosphorica, right? And then you changed to Kali.
No, the last patient with the leg, Marianne? You mean the last patient?
Yeah, in the last patient, you thought
he had sulfur. He had
sulfur.
Yeah. We had sulfur, and then we changed to Calcarea sulfurica.
Right.
Which is a very good remedy for skin, and it seemed to be a bit better, but not really. And then that strong aggravation, and I really something had to happen, so I switched to KALIUM sulfuricum.
Yeah.
Yes. And what is your question?
The question is how you difference between Kalis and Calc group because they are very close, right?
Calcarea group, yeah, they are very close. And in that case, you cannot difference so much. But as I had used already Calcarea sulfurica, and it was not working 100%, and it was a difficult situation, I said, what can I do now? I only saw the solution to switch to KALIUM sulfuricum. And the message is they can be so close. For me, also impressing. And the patient is saying, I feel different. Now something changed. My leg feels more soft. So, yes. Is that an answer for you, Marianne?
Yeah. Thank you very much,
Okay.
Beatriz. And once again, thank you very much for sharing all your knowledge.
Yes. Dr. Manish, we are friends. You know, we have a South American group. Perhaps you don't know that. And we are friends and always happy to be with you with IFPH.
Okay, thank you. There is a second raised hand from Dr. Hariharan. So please unmute yourself.
Okay, Dr. Beatrice. Good evening.
Dr. Hariharan, can I see you, please? Can you show your
face?
Your face. Okay.
Okay, doctor, your anyway, your Kali group, entire class is very nice, and the case and this case you quered is also very good. But I like to comment about the Kalika, which is a strong constitutional remedy. Is it correct?
Yes, a very strong constitutional remedy, Kalium. Yes.
See, mental symptoms, regarding mental symptoms, strong sense of duty is for these Kali corporations. And see, not flexible. They are not flexible.
Yeah, that's true. Yeah.
That is true. She's
not
always
flexible.
Okay, always sees right and wrong. Always. Right, sees right and wrong. Then I want to say another thing is they are uncomplaining type. They are uncomplaining type, Kalika. One of the most.
Can you repeat what do you mean by that? I don't understand that phrase now.
See, uncomplaining. Then in domestic.
Uncomplaining. Okay.
Uncomplaining.
Yes. Yeah,
Yes, and
like this lady, she was very bad. She did not phone. She had the ulcus, not connecting, uncomplaining. I understand. Yes, thank you.
Next is that there is sense of duty. They are having very much sense of duty.
Yes.
That is another
And
thing.
you know, they're very sensitive inside, Dr. Ramadevi. So
Sense of
they
duty.
seem to be strong outside, but they're very sensitive, like pulsatilla inside. And that
Okay.
makes that kind of ambivalence in their inner feeling.
See, another thing is that they are caused personalities. Never disclose symptoms if otherwise we must ask and we must find out their symptoms directly. It is very it is very difficult. That means never disclose their symptoms. That is one of the another peculiarity.
Yeah, that's why it's difficult to detect KALIUM. They don't, yeah, that's true. I'm happy that you feel you have the same information in India like we have with our German patients.
Okay. Doctor, next is that
Because I thought in Germany we have the tendency also to be correct, everything in order, tuck, tuck, tuck. It means that we have a lot of KALIUM personalities naturally in our country. But it seems that you in India also know that point.
Very correct. See,
yeah, okay. Interesting.
See, they have the fear of disease and fear of future.
Yeah.
One of the main barriers.
That's true. Thank you.
That is
I
what
think Dr. Rampravesh also want to talk.
This is only
Thank you.
only my comments regarding.
Thank you.
Thank you.
Okay, doctor.
All good evening, good night, good morning. Very, very nice presentation. Excellent session, Beatrix, madam.
Thank you.
Nice presentation case. This the KALIUM carbonicum.
Yes.
Excellent. Treat the patient according to homeopathic science in visualization treatment. Single remedy and the intercurrent remedy, tuberculosis, calcarea force. Very, very thanks. Very, very thanks.
Thank you, Dr. Ram.
Dr. Ramadevi, we still have 2 minutes left. Please say what you want to.
Okay. Can you hear?
Yes, ma'am, you are audible.
Dr. Beatrice, I hope you remember me.
Yes.
See,
yes.
The presentation was so nice. Each case was better than the other. And about Kalika, it is even though it is uncomplainable, they fight for their bread with the family members.
Yes.
Kalika, one symptom is that they fight for their bread to their family own members. That is a peculiar symptom I had seen in Kalika. Your presentation was very, very, very nice. Yeah, thank you. Keep it up. Come again and again. Okay. Thank you.
And I think you are the lady which has been working so well with to have this infertility. It's you, huh? I know you. I did not see your face very well. No, I know you better. Nice.
No, that's right. That LM potency, Dr. Patel's.
Yeah.
I told you, no?
Also.
Okay.
Yes.
Okay.
Thank you very much.
Okay. See you. Come again.
See you next time. Yes.
Okay.
Yes.
Last question of the day, the last raised hand, it's Dr. Mahmood Zodin. Dr. Mahmood.
Am I audible, please?
Yes.
Yeah, thank you. Ma'am, your last case that shows the redness of the patient, was that an allergic reaction or it is an infection? Can we discriminate?
Yes, in the beginning I said I thought it would be a kind of allergic reaction, but then I could see it was a kind of inflammation, a slow inflammation. Luckily, it was not exploding like an erysipelas. For this, we had to treat as an acute disease.
What I'm thinking of, choosing among remedies some remedies to treat inflammation or to treat infection. This will make a gain for the homeopathy field for treating patients. Can we segregate some of the remedies? This is for inflammation mostly, and this is for infection. And accordingly, we might create a new line of antibiotics to be delivered to the market. Can we think?
That's a good idea, Dr. Mahmoud. But to be clear, in that case, normally I start with sulfur for the infection, and sulfur we know is very good to prevent erysipelas. But with her, it was not working 100%. And as being a kalium personality, for her, kalium sulfuricum was a good solution. For another patient, it can be different.
Yes.
Okay.
Thank you.
Yes.
Thank you, Dr. Beatrix. And like this, the English session has ended for now. And thank you very much. The session was very fruitful, and I would like to congratulate you, and would also like to request you to please join again, and please come again and teach us more about these kind of medicine and cases.
Thank you very much, Dr. Manish, and thank you very much for moderating the session. And thank you all to all my friends. And I see you again.
Thank you. Shaila ma'am, you can please continue the next session. I have already made you the host.